Hi, welcome everybody. I know there's a few people still joining us, but I will start just because I don't want you to overrun too much. So I'm really excited that you're all coming to listen to this webinar. It's a half-hour webinar with questions at the end, but if you do want to put any questions into the Q&A, then that would be great, and we can answer them afterwards. So we're so excited to show you our fantastic recently released online platform, which is packed full of resources and quality improvement projects to make your lives easier. And in fact, I think you'll wonder why it wasn't invented years ago. We're going to show you how it can save you and your team's time, money, and how it's easier than you think. It has three main components in it. There's information, there's resources, and there's a way to help people connect with each other to share ideas. So my name's Abigail Fry. I'm a GP in Brighton and also one of the directors of Greener Practice. And I'm just going to take you through a little bit about what the platform is. And then Artie Bansal, who's a GP in Sheffield and one of the co-founders of Greener Practice, is going to give you a little bit of a background to the history of Greener Practice and the platform and why it was requested. And then Jess Winterby, who is the project lead for the platform, is going to give you a behind the scenes tour of everything or some of the things that are in the platform. So you move on. Whoops, sorry. So when people think about sustainability and greener practice, they often just think of things like recycling and saving energy, but we're here to show you that our online platform supports practices to give high quality healthcare that's good for patients, good for practices, and good for the planet. So it provides information and education on high quality, environmentally sustainable healthcare. And whereas a lot of these sorts of resources stop there, R1 will help you to take action to provide this high quality healthcare. And it also helps you to connect with others so you can share ideas and your successes and issues along the way. Now, how can this website help your busy practice? Well, we have step-by-step, ready-to-go projects for all staff, including trainees, and it makes them quick and easy to do, and even will support practice pharmacists as well. It will save you money and it will save your practice workload and save time. And it will give you quality improvement projects which are all evidence-based and follow nice guidance as well. And we also have quality improvement projects which will help with your staff well-being. And we have evidence, we'll provide evidence for your CQC inspections too, and not just on sustainability, but on other quality improvement standards as well, including things like medicines optimization and safety. And the best thing about it is that everything's in one place. Now, some of you will probably know about the Green Impact for Health Toolkit, which has these 16 different areas to help your practices with sustainability. And within each area, there's lots of actions to do. And our platform will link closely with this so that you'll be able to find evidence to help with each of these areas. And then that will help you gain awards. Now, I'm just going to really quickly tell you about some of the projects that we have on our website. We have lots about asthma to help with asthma care, including the new NICE guidance. And this is one where you can save time in your practice because patients will have better asthma care, so they won't be coming in so much with exacerbations. It will reduce your practice's carbon footprint and will save the ICB in your area money on inhalers. We have another project on switching from single-use metal and plastic equipment to reusable. And this is one that I've done in my practice, and we're now starting to save money from the second year onwards, and it's about 1,500 per year. And as you can see, that is cumulative saving that will increase year on year. And we have this project on the website, and it will give you real step-by-step, easy instructions to follow. We also have projects such as this deprescribing one, which can be done across the whole PCN. This one was one that was done in Liverpool, and it has large savings for the ICB, but it will also save your practices time, as you won't be signing so many prescriptions and dealing with so many medication interactions. Then we have some non-clinical ones such as this, which is to do with optimizing your energy in your practice. And this was done across Cornwall, and there was an average of about £4,000 per year of practice savings identified, with one practice saving up to a whopping £22,000 per year. So I'm now going to hand you over to Arti, who will tell you a little bit about the background to the platform.
Thank you, Abby. So hello everyone, my name's Arti Bansal, and I'm going to talk to you a little bit about Greener Practice, who we are, our story, and why we've developed this platform. So Greener Practice is a community interest company. We're not for profit, and we're a national network of people working in primary care, a community of practice, and we're grounded in the reality of what it's like to work in general practice. So we're very much designed by clinicians for clinical practice. And our mission is to enable primary care to move towards environmentally sustainable practice. And we do this by providing a hub of practical resources and a UK-wide network for connection and sharing of best practice. Our story started back in 2017 when Dr. Amar Rughani, who was then Provost of South Yorkshire RCGP, and I were having a conversation. If you could go to the next slide, please, Abby. And we were talking about the interconnectedness of climate and health, how planetary health is the foundation for the building blocks of health, has a huge impact on health, but also how tackling the climate and ecological crisis offered real win-win opportunities to improve health at the same time. And Amar asked me the question, how do we support our professional community to take action? Next slide. So this led us to consider who else might be interested locally, and we started a monthly meeting pre-COVID around the kitchen table with a group of local GPs. And in our meeting, we thought about local action as well as national action, and we very much worked to our strengths, our interests, and our connections. And one of the first things that we did was create a one-stop website for general practice, which made the case for better and greener healthcare, and also linked to all the other resources and organisations that were already working in this area. Dr. Honey Smith had the idea of asking the RCGP to declare a climate emergency, and this has led to engagement with the college, which continues to this day. And Dr. Mike Thompson's deanery level experience in GP training meant he was the ideal person to lead the work on developing the RCGP planetary health curriculum for GP trainees. We worked with Dr. Terry Kemple, leader of the Green Impact for Health Toolkit, which some of you will be using, to champion this resource as well as support its development. And we formed a community interest company to better represent this work and collaborate with organisations. Next slide, please. Dr. Honey Smith then led the work to encourage the formation of local groups outside of South Yorkshire to harness the power of connection. And our first group outside of Sheffield was in London, formed by Dr. Tamsin Ellis, who had been working with the Centre for Sustainable Healthcare, and she joined our leadership group, doing incredible work in articulating the story, including on this Radio 4 programme, which reached over 1 million listeners. And we were soon joined by groups in Bristol, in Glasgow, and today we have over 30 local groups across the UK, from the Highlands of Scotland to the Channel Islands and the tip of Cornwall. And over the years, we've been lucky to have many incredible people, too many to name, to join our leadership group, bring their real world experience of implementing change with groups of practices across the country. Next slide, please. As well as local groups, though, we also started national conversations through national special interest groups. And one of the real world questions that kept coming up in these national forums was how to tackle carbon hotspots around inhalers, which is 13% of the carbon footprint in primary care. And this is an example of how important our clinical groundedness and expertise is in understanding, framing, and creating solutions for general practice. So the carbon footprint of inhalers was being framed narrowly as an environmental issue, which involved asking people who could if they were interested in an environmentally friendly inhaler. But there were also concerns from the respiratory community and patients that this might not be done safely and appropriately. So initially, we brought together experts in the field and we worked with NHS England Inhaler Working Group to create a guide with principles on what to do first and how to do it safely. And this was welcomed, but our busy clinicians in our network told us they needed more support. Next slide, please. So with the help of funding from the Health Foundation, we used a system QI lens to consider how to improve the care of asthma patients in the grounded reality of the many ways in which patients access care in general practice, from presenting with symptoms to medication requests to annual reviews to emergency out of hours letters. The whole team was involved in improving the quality of care. Next slide, please. The biggest takeaway from this work was in how the issue was framed, because reducing the carbon footprint of inhalers is best achieved not through an environmental, but through a clinical lens. Through a primary focus on improving asthma control, we need patients to take the right medicine and for that medicine to get to the right place in their airways. And the right medicine tackles the problem of reliever overuse, and the right place tackles a real-world problem of poor inhaler technique. And offers patients a choice in the inhaler they can use and the inhaler they want to use. Next slide, please. This approach is an example of how the principles of sustainable healthcare lead to better healthcare, as this diagram from the Centre for Sustainable Healthcare shows. So the principles of quality improvement in sustainable clinical practice improve patient outcomes safely. They tackle health inequalities. They reduce unscheduled care and therefore save the NHS money, as well as empowering patients to manage their care. And this is true of nearly every clinical area. It's the win-win story we've been telling for some time about greener and better healthcare. Next slide, please. So we developed the high quality and low carbon asthma toolkit with 10 step-by-step quality improvement projects that address the entire clinical pathway, from improving diagnosis to identifying poor control and prescribing changes. And the projects are designed to include all the resources you need, including education videos, IT searches, patient leaflets and videos, and pre-written text messages. We've collaborated with lots of organisations, including IT organisations, patient-facing organisations, respiratory organisations, and the last iteration is up to date with the new NICE guidance. And it's been very well received by users and highly commended in the GP awards. Indeed, even now, the NHS even uses the term high quality and low carbon asthma care. Next slide, please. However, our resources were still only being used by enthusiasts, and we wanted them to be mainstream. Whatever people's motivation, whether it's to improve care, to save money, to save time, to meet quality standards, to easily find a quality improvement project for your trainee or medical student, or to tackle the climate crisis, our projects will help. And we also want to make it easier for those who are already engaged, including the 1,400 practices who are registered with the Green Impact for Healthcare Toolkit, to find a project that helps them take action and get their awards. Next paragraph, sorry, next slide. So we took the proposal to the 2024 SBRI NHS Net Zero Awards to create an off-the-shelf, user-friendly platform for the whole spectrum of clinical and non-clinical activity in general practice. And our proposal used the EAST model of behavioural change. We wanted to do this in a way that made the work mainstream and accessible to the whole of general practice. And secondly, where the network of users would be able to contribute to, improve and spread best practice. We did win the award in the clinical engagement category. And over the last year and a half, we've been working really hard to create this online searchable, practical, user-friendly resource that we think starts to answer the question of how to help our professional community to take action. And now I'm going to hand over to Jess Winterby, the incredible lead for this project, to demonstrate it to you.
Thanks, Arti. So let's dive into the platform. As Abby said earlier, the platform has three main aims. Number one, to provide information on environmentally sustainable, high-quality healthcare. Number two, to help people take action to provide that high-quality healthcare. And number three, to help those taking action to connect with others who are also taking action. Here you can see the About section. This is the Information section. Here you can find details about what environmentally sustainable practice actually is, why it's important, and tailored information for students and trainees and for patients. In this section, You can also see some planetary health cases. These are realistic examples of everyday cases you might see in general practice, in which the patient's poor health is clearly connected to the declining health of our planet. Now let's take a look at the Take Action section. Here you can see the project library, a bank of over 50 quality improvement projects. These range from clinical projects covering topics such as improving asthma care and reducing medicines waste and disease prevention, to non-clinical projects such as improving practice energy use, optimizing staff travel, and adapting to extreme weather events such as heat waves. You can find the right project for your practice using the filter function. This lets you search based on benefits such as money and time savings and improving staff well-being, who can do the projects such as GPs, nurses, and practice leads, and topic such as medicines, prevention, and investigations. You can also filter to find the quickest projects and the ones with the highest carbon savings. The project library can help many different staff members. Are you a busy GP? Are you a busy GP responsible for doctors in training and medical students? The library has ready-to-go projects which your trainees can do with minimal supervision required. Or perhaps preparing for CQC inspection is of more interest. The project certificates can help provide evidence for meeting multiple CQC standards. If you're a GP trainee, completing your portfolio can help you tick off both quality improvement and planetary health in your portfolio. Or you might be a nurse or pharmacist looking to improve asthma care or the medicines for your patients, in which case the medicines and treatment projects will do just this. Or perhaps you're a busy practice manager looking to save money off practice energy bills or improve staff recruitment and retention. In that case, our energy saving and staff wellbeing projects are just the ticket. So let's look at, more closely at the project. Here you can see our vitamin D testing project, which aims to reduce unnecessary testing. All the projects are set out in the same way, which makes them easy to implement. Here you can see that it tells you how long a project might take to do, who can do the project, which area of the Green Impact for Health toolkit it helps with, which CQC areas it helps to provide evidence for. Below here, you can see the benefits of the project for your patients, practices, and the planet. Here is the background to the project, which includes relevant evidence and guidelines. And below here, you can see the step-by-step of how to actually carry out the project. This includes downloadable IT searches and patient-facing messages. Many projects also have a top tip and advice on how to scale the project up or down, such as to a PCN or ICB level. Once you've completed the project, you can enter your data to download a certificate, which will summarize the benefits for your practice and, where relevant, the financial and carbon savings. For example, if we take the vitamin D project, we imagine that 60 vitamin D tests were carried out in your practice in the month before you made your intervention. And then after you made your intervention, you'd reduce that number down to 30. Then this would produce an estimated annual carbon saving of over 3,000 kilograms CO2 emissions and an annual cost saving of over £5,000. You would then write a small paragraph explaining how you'd carried out the project. And then you just press this and you'd be able to download the certificate showing what you've done. I'll just give you an example of that. So here you can see the certificate. It shows you the estimated annual and carbon savings and the benefits, and also the CQC areas evidence. And there is the little paragraph that you wrote. So as you can see, the project library is packed with a wide variety of projects, so there should be something for everyone. And all the projects are in the same format, making them easy to implement. Now let's take a look at the resource library. Here we have gathered together over 120 useful resources to help busy GP practices provide high quality but low carbon healthcare. It's your one-stop shop for everything you might need. It includes an adaptable GP practice green plan, a timeline to accompany this plan, a guide for setting up a green team to enact the plan, and even celebration slides, which can be used to display all of your green team's great work. it's likely that all organisations will need to have their own green plan in future. The resource library makes this as easy as possible to achieve. There's many other great resources here too. It might be that you're interested in the carbon footprint of your practice. In this case, you can use this easy to use online carbon footprint calculator. Or perhaps you're more interested in updating your waiting room. In that case, we have videos, posters, newsletter articles, which can be used for patient and staff. The other thing that can be helpful here is practice policies. So lots of the Green Impact for Health toolkit needs you to have energy policies or fuel poverty policies. And I'll just show you some examples of those. So here you've got the electric and lighting plan, the heating plan, the fuel poverty plan, and the GP green plan again. The Take Action section also has pages on getting started, which explains how to begin if you're new to greener practice. The tried and tested asthma toolkit, which is the best place to go for information and projects for high quality and low carbon asthma care. And Driving Change, which outlines options for making a difference beyond your GP practice. And finally, let's take a look at the connection section. Here you can see our network map. This shows all of our members and means that you can easily find other people across the country who are working on similar projects so that you can ask questions, share ideas, and inspire each other. You can also find your closest local greener practice group, which is a great way to connect with people in your area and work together for change. The special interest WhatsApp groups allow people across the country to easily connect on specific issues, such as nature and communities, non-clinical issues, education, and clinical. I'll now pass you back to Abby, who is going to explain how you can access the platform.
Hi, thank you, Jess. So I am, as I said at the beginning, a partner in my practice, and so I know what the stresses are like for practices at the moment. And I want to just show you what other people think of our website as well, so people who are already using it rather than just listening to us three. So this is a short video just for you to look at.
I'm a new Phoebe registrar, and I've been using Green Practice for the last couple of months. I especially like the project library that it has as full of practical evidence-based ideas that can make sustainability feel achievable in general practice. There's also a way to connect with other people also doing sustainable QI projects. I think it's made a real difference to my training and how I think about sustainability in general practice.
Hi, I'm Margaret Ikpom, a GP partner in Hull, and I'm also the Vice Chair for Professional Development and Training Standards for the Royal College of GPs. Since we tapped into the Greener Practice website a couple of years ago, one of the first things we did was set up a green team that meet regularly. And one of the most profound things that have had such an impact on the practice is tapping into the asthma toolkit, because it's had a dramatic effect in terms of the reduction of CFC-free inhalers that we pretty much no longer prescribe in practice. So it's been an absolute privilege to be part of this initiative. Thank you.
I just love the Greener Practice website. It's such a great platform. I've used it for IMD prescribing, for the asthma toolkit, and for posters to share with my team and my patients. It's my go-to sustainability website.
Brilliant. So I hope you enjoyed that little video. And we've now got over 700 individuals who've signed up to the platform, even though we've only recently launched, and we don't want you guys to miss out. We also have lots of practices and lots of PCNs and even a medical school with others who are interested. And other larger organisations have also been interested, such as the Royal College of GPs, Green Impact for Health Toolkit, and NHS London Appraisers as well, to use it for their appraisees. So how do you sign up? Well, this is the homepage, a landing page of the website. You can get to it through that QR code or at www.greenerpractice.co.uk. And if you go to the top right-hand corner, there's a little sign up button. If you click on that, you'll be taken to this page. And there's different ways you can sign up to different types of membership. So you can sign up for free as a network member, and then you'll have access to our local groups. There's 30 local groups at the moment. And also WhatsApp special interest groups. There's 6 different areas, clinical and non-clinical. You can get newsletters, and you can see where other members who've chosen to put on the map where they are, you can see where they are. You also can pay for a Network Plus membership, and you can do this as an individual, and then you have access to all the project library and the resources. But ideally, you'll join up as an organisation, so a number of people can access it across the organisation then. And you'll also get a Proud to be a Greener Practice logo for your website. So this will show instantly to others, and including your patients, that you're doing work in this area as well. Now, if you ask about costs, these are the costs for organisations to sign up, and it works out as about 1p per patient. And people say, as you noticed on that video, someone had said that it pays for itself within an hour of signing up. And as you could see from some of the different quality improvement projects that we showed you, that you will get savings from it, and it can be at least more than sort of 10-to-1 time saving on whatever you pay. So ideally, it is something that you'll do, and we've kept the cost as low as possible just to keep. We have some people that help us, which I'll introduce one of them shortly, and we also want to keep updating the website too. So that's the end of our webinar. We will, as I say, stay on for questions as well if you have any questions. So you can either stay on and ask us now, or if you don't have time or are a bit shy, you can email the contact@greenerpractice.com, and I'll ask Emily to jump on, as she's the one that mans this and is our network development officer. And she also has some feedback that she would like as well. So I'm going to stop sharing the slides and over to Emily.
Oh, thank you, Abby. Thanks everyone for joining. It's great to see how many people are here. We've got a few questions in the chat. So we have one asking, if we want to promote the new Greener Practice platform, how would we best do that? In brackets, social media, wider membership comms, and similarly to that, we've also got Annette Downing-Call asking, how can we best promote the website? Could we share a simple poster, images, etc.?
Yes, definitely. Please do promote the website. We do have some sort of marketing things that we can share, depending what sort of thing that you would like. And we do have an excellent comms lead who made the video called Romina. So she will have access to other things. And Emily's you've been getting involved in that as well, haven't you? So I don't know if you want to say a bit more.
Yes, well, Romina is definitely the comms queen. She's amazing. But yes, definitely, I think in our future newsletters, I think it'd be great if we could maybe supply some images to help other people share our message and promote the platform more widely. We also have a question from Sarah. She says, thank you, love for the practical approach to action and info, RE, all the projects that now look manageable. She says, I've been contacted by a keen doctor in New York. May I send him the link to your new website? And would it, so he could potentially use it where appropriate?
Yes, hi Sarah. We know about that question, and we did put it to some of our legal team or our people that we've asked, because I know there has been some issues about sharing it beyond the UK. I don't know if Katrina Davis, if you know a little bit more about this as yet. She's one of the other directors who I can see has popped up.
Hi there. Yeah, thanks for that question. I think the main thing is that obviously the way things work in America is very different from the way they work in the NHS. So anything that is adopted, we just need to make sure they're aware that it would have to take into account whatever it is that's the American system. Yeah, that's the main thing.
And does anyone have any questions that they want to ask? And like, you're welcome to put your camera on and your mics on to ask anything. You can put your hand up.
We do have another question as well, in the meantime, asking if there's a discounted price if you join as a PCN of 14 practices.
The pricing goes very much on your patient size. So if you're larger than what I showed you on the presentation, then please do get in touch and we'll be able to give you an idea. But if you know the number of patients across the 14 practices in your PCN, then we can give you a price for that. But it'd be great to have you on board.
We've also just had a quick question from Jennifer saying, what about federations that do not hold a caseload?
So federations usually are a federation for a certain population size. So I know in Brighton, for instance, our federation sort of works with all the practices in Brighton and Hove. So it would be the practice, however many patients that is for it, because what happens, the reason it's sort of per patient is because that tends to correspond with how many staff are there and how many staff would want to access it. So the more patients there are, the more users you get to use the platform, if that makes sense. But please do get in touch with any sort of questions around this and we can give you more of an idea.
I believe I've unmuted you, Louise, so please go ahead with your question. Hello, Louise, who has her hand up. I'm wondering, hopefully you can speak.
No, or you can put it in the chat if you want. No. Any other questions at all? Jess.
Yes, hi. So it's not so much a question. It was just to say that all the projects on there, we've tried as much as possible to base them on projects that have already been done, or some of them are new, but we'd love feedback on them. So if you're doing a project from the platform and you think, oh, this worked really well, or this could be improved on, please do let us know, because that will help us improve it further. Thank you.
And Honey.
Thanks. That was brilliant. I knew it would be, and it was. Can I
Honey Honey is one of the other directors of Greener Practice.
Thanks, Abby. Louise has asked a question about finding on the website the pages of how, and it is a bit tricky because it doesn't immediately come up. Could one of you, because I'm not very competent, just it's what to do if you're not logged in, isn't it? So I think you have to click on the project. If you click on the project library and then it says you have to be a member to do this, and then I think there's a button, isn't there to say these are the membership options. I just wondered if it might be worth showing people so they can see the membership options before they leave the meeting. Is that possible?
They can. I know it through the sign up. If you do go to the sign up on the top right hand corner, that takes you to all the different options. So that might be the easiest way in. And then you get the 3 different options. And
I've just put the price structure in the chat as well.
Brilliant. Thank you. And thanks, Louise.
I think that's it for questions. If I'm able to Go Katrina.
I think there was one more, somebody trying to find out where on the website it's for less than 10,000 users, saying they couldn't find it. I think it depends. You should be able to find it. I've just found it. So you just go to network organization membership, and then there'll be options for each of the different sized practices, and less than 10,000 patients is on there. So I'm not sure whether that helps or not, whether it's worth me showing you this.
Yeah.
Hang on a second then.
The other thing, Louise, you can do is if you're signed into the website, if you just search member, and it will bring up that thing that, yeah, that's it. But if you're still running into issues, just yeah, email us at contact@greenerpractice.
Yeah, I'm probably don't know if anybody's found this. Okay, yeah, if you email us, that's great. It's definitely on the one I'm looking at, so I think maybe I'll see if I can share that, but it doesn't seem to be wanting to share at the moment.
And I can see, so I've just found the chat. Mike's mentioned about historically we've welcomed people from overseas, which we still do, to join in. It was only that if they're using our resources, I think it needs, they just need to bear in mind they're from sort of NICE guidance and things, which is good medical care.
I don't know if you can see that there.
Mm-hmm.
So this is the less than 10,000 patients under the Network Plus organisation. And then you select, and that comes to this page, fewer than 10,000 patients, and that's how you sign up information.
Thank you. So thank you so much, everybody, for joining. If there's only one Greener Practice lead, can we just sign up to Network Plus member? If it's ideally it's for an organization, so you can share out the users, so not just one person's doing the projects in the practice, but as an individual you can sign up as one and just do it all yourself. But we found it can work well if you have a team doing different ones, because then some can be non-clinical, some clinical, and you'll get more buy-in and more done in your practice. But yes. And thanks, Martin, for your message. I'm glad it's a bit clearer. But please, so please do let us know if you have any other questions, anything else, just you can contact